Okay, good morning and thank you for joining us today. Teresa is not here for the YouTube session. I'll now report our daily case counts. We now have a total of 13,095 cases, an increase of 29 cases from yesterday. Of these 29 new cases, 2 are outbreak related, 11 are close contacts of confirmed cases, 7 are community acquired, and 9 are still under investigation. At present, there are 235 cases that are currently active. 12,468 cases have been resolved. We now have a total of 392 people who died as a result of COVID, an increase of 3 deaths from yesterday. Of the 3 new deaths, all are from community: a man in his 60s, a man in his 70s, and a woman in her 80s. I want to express my deepest condolences for the families who lost their loved ones. 46 cases are currently hospitalized and 10 cases are in the ICU. In Windsor-Essex, we have so far administered a total of 30,334 doses. 11,607 residents have received both doses of the vaccine, and 7,120 residents have received only the first dose of the vaccine. I'll now move on to our epi summary for this week. Okay. So starting off with the picture of what it looks like in Ontario, and as we see that the cases continue to hover around roughly 1,000 cases a day in the province, and it's basically stuck there and not coming down. Similar picture in Windsor-Essex, that we have seen a significant decline, but still the cases are hovering somewhere between an average of 25 to 30 cases a day. Comparing our cases with the rest of the province, obviously we are doing slightly better than the provincial case rates, and but right now what we're seeing is almost like a plateauing of the cases, which is still hovering at a higher rate for our region. Looking at the cumulative cases and deaths of deaths as a result of COVID-19 in Windsor-Essex, after a steep increase in the number of cases, we are starting to see some early signs of flattening of the curve. But as I mentioned, the day-to-day case counts are still significantly high, driving our numbers, our daily numbers to between 25 to 30 cases every day, and in some cases it's less than that. Similar picture with respect to the deaths that are related to COVID. We are still continuing to see some impact of COVID, and still reporting deaths as a result of COVID on a fairly regular basis. Looking at our week-over-week incidence rate per 100,000 population, starting all the way from week 18th last year to our current week completed week, which was week 8. And our most recent completed week's rate was 54.1 cases per 100,000 population. This was slightly increased from last week, which was at 41.9 cases per 100,000 population. Looking at our weekly case rates, this is what it looks like compared to the southwestern Ontario and as well as in Ontario. What we're seeing is our weekly case rates are and the provincial case rates are pretty much close to each other, while the overall regional case rate is slightly less than what we are seeing in our region. This is the data that shows our wastewater surveillance result, and just a reminder that this is still a research that is currently being undertaken by the Great Lake Institute, and the data from this should be used with caution, because this is still evolving, and what we are seeing right now is the cases and the wastewater surveillance data is aligning pretty well with a slight increase in the last couple of weeks, but then it's starting to go down, similar to what trajectory we are seeing in our region at this time. So this figure looks at all the test and unique individuals tested by week in Windsor-Essex. And in total, 280,402 tests were completed as of February 27th. This is a complete week ending on a Saturday. For the week ending on February 27th, our percent positivity was 2.6%. This looks at the most recent 7 days and not the completed week, and the most 7 days are preliminary and subject to change because we know that we don't have the full data. However, in the past 7 days, Windsor-Essex has the 8th highest percent positivity in Ontario, sitting at 2.5%. This is slightly decreased from last week, which was at 3.2%. Looking at percent positivity by age group, all the age groups are relatively low in terms of percent positivity, and pretty much similar percent positivity in each of these age groups. Focusing just on the percent positivity by school-age children, again, similar picture. What we are seeing is the overall percent positivity is down significantly, close to 5% in each of these age range. Yesterday, we were asked about the data from the school and how we compared from the November and December timeline. So basically, this epi curve gives you an indication of what kind of cases we were seeing in November and December when, and then comparing to where we are right now. As we can see, our current 7-day average is 2.6 cases, which is similar to what we were seeing in July 2020. So it's nowhere close to what we were seeing in November and December. With the enhanced guidance on the VOC and the concerns, there may be more cohorts being dismissed, but overall the cases are similar to what we were seeing in July and not necessarily what we were seeing in November and December timeline. So comparing our school age 7-day average to our overall 7-day average, and the difference, as we can see, is pretty much negligible. In the month of February, both rates have generally leveled off. And overall, the cumulative cases in school age children, again, if we want to see, we've seen a huge increase in the number of cases in November and December, but again, similar trend. What we are seeing is the curve is flattening even for the school age children here as well. This graph looks at the percentages of test results that are available within 1 and 2 days of someone getting tested using a 7-day average, and approximately 54% of these tests are being processed with results available within 1 day of being tested. Within 2 days of tested, 94% of test results are being processed with the results available, so which is definitely a good turnaround time for our region. Percentages of test results available within 1 day across Ontario based on the 7-day moving average, and when we are comparing our health unit, we are at the last 1/3 of the time it's taking for a majority of our test results to come back. This particular graph looks at how long it takes the results to come back for a person that is tested in Windsor-Essex, and which is currently sits at 1.7 days. And this is a slight decrease from last week, which was 1.6 days, but overall, within 2 days, people are getting the results back here in our region at this time. Overall cumulative regional and provincial rate, our region continued to have the second highest rate in the province of Ontario. This graph looks at the rate by municipality, no change, and this is the cumulative picture. In the last month or so, similar picture with Leamington leading the highest case rates, followed by Windsor, and then followed by the rest of the municipality. This is the distribution of cases by municipality, and overall distribution, 55% of the cases are from Windsor, which is similar to what the population distribution is between the city and the county. Last 30 days, more cases from Windsor, 69%, while the rest of the municipalities, except Leamington, has similar case rates. Just in the last 7 days, even more cases in Windsor, the city of Windsor, 82% of the cases are coming from there, and followed by Kingsville and Leamington, while the rest of the municipalities had very low case rates around. In terms of age and sex distribution, as a similar picture what we have seen last week with the cases in the 50 and 60s and 70s are slightly increased just in the last 2 weeks, but overall in the younger population, the case rates are either declining or stabilized. This graph looks at our non-epidemiologically linked case, or in simpler terms, our cases acquired in the community where there was no known source of exposure. So currently, using a 7-day average, we see that about 16% of our cases do not know how they acquired the virus, which is slightly better than where we were roughly on an average by 25% of these cases. Essentially that means the cases are still well contained in the region. This graph looks at the exposure history by all the cases in the region, and just focusing on February to present. What we are seeing is mainly the cases are acquired through close contact, household contact with other cases, and some from the community and also some from the outbreak. But as I reported, overall our non-epi-linked case rates are going down, which is a good sign. This figure just breaks down the same data by each of these municipalities. This graph looks at the number of active outbreaks. So we had quite a significant outbreak in the month of January, but that's starting to go down. And right now we have 12 outbreaks that are currently being followed by the health unit. This figure shows the COVID-related hospitalization in patients in the ICU on any given day, and it includes both new patients as well as the existing patient. Hospitalization have decreased this past week, and is also reflected in our 7-day average. But however, COVID-19 cases in ICU is slightly increased, but again, it's still in the low range at this time. Day-over-day COVID-19 admission, it's going up and down, but in the last week or so, we have seen up to a maximum of 6 cases admitted in just 1 day. With respect to acute inpatient occupancy, we can see that the hospitals are already operating at max, more than 90% of the capacity. Similar picture in ICU usage. The ICU bed capacity is also anywhere between 85 to 90% and coming close to 100%, with also the vented adult ICU capacity is passing the 50% threshold as well, which is triggering some stressors to the hospital system. So overall, 95% of our cases are resolved, and 1.4% are self-isolating at this time. 3% of our population have lost their lives as a result of COVID. This graph breaks down the date of death, and as we said, that even though when we are reporting 3-4 deaths a day, that doesn't mean that the death happened on that specific day. It could have happened a few days ago and reported just recently to us. Overall, again, 63% of the people who died in our region were in the 80 plus category, and overall 96% of the people who died in our region were 60 years and older. Our case fatality rate is higher than the province of Ontario, and is currently at Ontario is sitting at 2.3%, but overall our Windsor-Essex fatality rate is up to 3% at this time. Our day-over-day doubling time is now better than the province as well as the Canada. The most recent estimated median R0 is 0.73, and again, this is a decrease from last week, which was at 1.03. And as we know, when the R0 is less than 1, each existing infection causes less than 1 new infection. If lower, it means that our case counts are decreasing. So In summary, the case rates in Windsor-Essex slightly increased this week. Acquisition sources is distributed between all of these household contacts and community transmission. Overall, COVID-related hospitalization has decreased, but cases admitted to the ICU have slightly increased. The doubling time has gotten better. The active outbreaks is relatively similar, but we were able to rescind many of these outbreaks in the long-term care home and retirement home. And as this final summary slide, the monitoring indicators for Windsor-Essex, our most recent completed weekly case rate was 54.1 case per 100,000 population. And then again, those weekly completed case rates end on a Sunday. But if we just look at the last 7 days, in just the last 7 days, our case rates are 39.3 cases per 100,000 population. Our person positivity for a full week is 2.6%, but just in the last 7 days, person positivity is 2.5%. Our R not effective is 0.73. So if we compare this criteria for the red control zone, we can see that if we are taking the completed week rates, it's 54.1 case, and but the most recent 7 day is right there at the border of being in the orange and red. Person positivity is slightly higher than what the threshold for the red is. R effective is less than what the threshold for the red criteria is. Thank you.
We'll now take questions from the media. Is there any questions from CTV?
Yes, good morning. So based on this information, I mean, I know yesterday you said you hadn't talked to the province yet, but would you prefer to see the area in red or in the orange zone?
Well, I think the numbers are fluctuating every day. Yesterday we reported 10 cases. This morning I'm reporting 29 cases. So the numbers are fluctuating, and we haven't landed on a very clear orange category at this time. The most recent 7 day is, yes, is suggesting 39.3 cases, but this number didn't include the 29 cases that we reported today. I'm pretty sure that if you add that 29 and then do the 7 day case rate, it will probably go over 40. So we are right at the border. I'm not saying that we are in a clear red or a clear orange, but we are right sitting at the border. And then you combine the rest of the indicators such as person positivity. So again, person positivity is also right at the border. Our effective, we're clearly better than what the criteria is for red. So based on those two indicators, I'm sure that's why the province is not reaching out to us to have the discussion about moving us into a lesser restriction, because other regions have seen that removing the restrictions, then it just drives the number up, and definitely we don't want to go into a position where we loosen the restrictions up too quickly and to see the increase and surge in cases and potentially then going back to where we were before. So we definitely don't want that, and I hope that if the numbers continue to be in the favorable range, we should have some discussion in the coming week with the province.
And what is your message to residents and business owners who are discouraged or even outraged if we don't move to orange next week?
Well, I think it's we still need to follow some of these public health measures, and I think it's slowly we are getting there. We dropped down quite significantly to 50 to 60 cases per 100,000 population per week. But I think what we are still seeing is we're not getting down to a clear orange or a clear even like less case rates. We have seen some fluctuations. We have seen cases in the 10s and in the 14, but we haven't seen that on a consistent basis, and that definitely shows that there is still a risk out there, and if the restrictions are eased up too quickly, then it may push us back to getting into gray lockdown or somewhere else. So we definitely don't want that to happen, and we'll continue to encourage everyone to be patient and continue to follow all these public health measures to keep everyone safe.
I noticed another retirement home has been added to the outbreak list with one staff member. Do you know if that staff member was vaccinated?
Well, at this time, I don't have that information. I can probably share that information next week.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Yesterday, the CEO of Windsor Regional Hospital said that healthcare officials across the country are walking on eggshells given the concerns about COVID variants and the threat of a third wave. I'm wondering, do you share those concerns?
Well, with the variant case rates increasing in the province, there is this possibility that we may see a surge in cases. We have seen COVID variant cases in our community, and so far things have been well contained. The risk obviously is there, but I'm just hoping and using my wishful thinking that maybe we can avoid that and we can continue to keep our community safe. But the risk is there, like there is no doubt about it, and the other countries have seen similar trends. We hope that it doesn't affect us that way. We want to focus on continuing to vaccinate and continuing to keep people safe so we don't have to see another third wave or a surge in cases in our region.
Okay, thank you. I also wanted to check in about how vaccinations were going at the St. Clair Sportsplex. Do you have a sense of how far along we are with vaccinating the latest priority group of healthcare workers?
Well, we are making a big progress with all these priority. I cannot say that how many people have been vaccinated so far. I just provided you a total number of people, which is slightly over 30,000 doses that have been administered in our region. And I can say with confidence in terms of the percentage of people vaccinated by population. Windsor-Essex is right up top in terms of how much coverage we have provided for our region so far. And it is all as a result of the great work that the health system partners are doing here with Windsor Regional Hospital, setting up that St. Clair College, and then the public health going into protecting all these residents, long-term care home and retirement home, and now running these targeted vaccination clinic. So as a community, as a region, we have done a great job, and we'll continue to do that, and we'll continue to go through the list. I cannot pinpoint and tell you what exactly we have covered in each of these categories at this time.
Okay, thank you.
Any questions from Blackburn?
Yes, good morning. I think you may have touched on this before, but we've had a question from, I think, a listener. So I'm just wondering, what's your message to families with disabilities, people with family members with disabilities who are living at home right now waiting for the vaccine? What is the timeline like for that population?
So I am anticipating that there will be more details that will be shared with the public by the province in terms of the phase 2 priority. So these are all phase 2 priority population with people with who are homebound, not necessarily registered for the chronic home care services or something like that. But some of these details will be released shortly. We are working through our internal plans on how we can support these individuals. The challenge is the mobility of the vaccine and our ability to register these people with confidence, and we need some support from our primary care providers and also our health system partners. So there are a number of moving parts to it. As an individual, maybe it may seem simple, but from a logistic perspective in organizing all of that, it's not that simple. So we are trying our best, working with all our partners to identify the best way to, first of all, identify these people, and then scheduling them for vaccination so we can provide the level of care that they're looking for at this time. So stay tuned, and maybe in the next week you will hear a lot more detail on those population.
Thank you. And just talking about scheduling, the Leamington Nature Fresh Farm Center is supposed to launch on Monday. How is scheduling going for that? Are you now, I guess, scheduling close to 400 appointments starting on Monday?
Well, in total, combining with the city and the county, we will be at close to that number. And right now, I think you will see there will be a media release coming later today with specific details on how the Leamington site will work.
Thank you. Any questions from Windsor Star?
Hi, good morning, Dr. Ahmed. So the Ministry of Labor has announced that inspectors will be coming to the Windsor-Essex region on Saturday, focusing on small business in terms of COVID safety. Could you talk about that? What's that going to look like?
I think we touched on that as well. So it's not necessarily just for the small businesses. I think there's a number of businesses that they will be targeting, and it's all part of their campaign that they have been doing for some time. And the whole idea is to make sure that the businesses are continuing to operate in a safe manner without putting anyone at risk, including employees or as well as the patrons. So we shared some of those details yesterday. I don't have that right in front of me, but I can say with certainty that it's not necessarily just targeting small businesses. It's they have all kind of businesses that they want to do that enforcement blitz.
Are these businesses that have been visited previously? Is this the follow-up on the two-stage campaign, or is this an education campaign as opposed to an enforcement one?
Well, I can't talk about the specifics that how they're doing it. Let's just keep it that they can visit any of these establishments. But the idea behind doing these inspection is to support the businesses, and we know that it's been almost a year, first of all, and businesses and everyone have been provided enough guidance and provided enough tool to ensure that the safety that they are operating the businesses safely. So I can't speak specific that whether they will be charges laid or whether they will be just an education. But from our perspective in our region, our message have been very clear that the guidance and all of these recommendations have been there for quite some time, and people should not expect that if they are charged, it's not the point that we are penalizing them. They've been given fair warning. They've been given enough education. So be prepared to do the best and keep everyone safe.
Moving on to a different subject, has there been any thought about vaccination programs targeting cross-border workers?
Not at this time, because this is the vaccines is not open for general public, and when I'm looking at the cross-border worker, they are part of the general public like you and I, and they will be included in that population.
Any timeline as to when they might be included?
I don't have a timeline, but I anticipate it would be late spring, early summer.
Thank you.
Any questions from AM 800?
Yes, Dr. Ahmed, I just have a quick question. I know Teresa touched on this, I believe it was this week or last week, in regards to if the health unit calls an individual 80 and over for the vaccine and they're unable to make the appointment, they don't get a different time slot. How about if the health unit calls someone and they're not home? Is a voicemail left, or do they call back, or do they just skip that person and go on to the next person on the list?
No, what we have heard, even and I know our team, so they have number of primary contact, secondary contact. So we go through the list and we try to get them on. It's not just a single call that they didn't receive and then they're out. It's not the case. We try to get an answer, and what we have heard is even with the second call or third call, we get the people. So far, that hasn't been identified as a concern, and I don't think that will be something that we will use to just move on to the next person on the list. We want to make sure that whoever is selected, they get their fair chance to register and schedule their appointment.
Okay, thank you. And then I guess, like you mentioned, so you would be surprised today if the province announces we're heading to orange zone. Your gut's telling you we're staying in red for another week?
Yeah, generally when some of these changes are happening, we do talk, we do have some discussion, and as I mentioned, that I haven't had the discussion, so I'll be surprised if they do it. But again, as I said, the numbers are getting in the right direction, and we really hope that it continues to move in that direction, and we move on to a lesser restriction.
Thank you.
Any further questions from CTP?
Yes, just one. Are you still concerned about the rate of the community spread at this time?
Well, I think we're getting better in that. As I reported that we have a 7-day average, it's 17% of our population are cases are acquired that are non-epi-linked and community spread. So it's less, but still there. We still have 235 active cases. We still have are reporting on an average between 20 to 25 cases a day, which is again mean that it is still exists. Things can change, so please take precautions.
And what would you attribute the community spread to?
Well, people either not following the directions or not paying attention to their symptoms, and that's how it's contributing to it. Or as we know that they can be symptomatic, they can spread the virus even before their onset of symptoms. So it could be a combination of all that.
Okay, thank you.
Any further questions from CBC?
Yes, I have two. We got a question from a member of our audience who was mentioning the lower efficiency of the AstraZeneca vaccine. So we were wondering, is there a way that someone could request to switch up or make a choice about what vaccine that they get, or perhaps wait until a different vaccine is available?
Well, I think right now it's all these vaccines that are available. Those are the vaccines that are available. And when people are getting the consent and everything, when they are given, when they are there, they will be told what vaccines they're getting. Right now, we only have Pfizer vaccine that's being used in these clinics. And we know AstraZeneca will be available through the pharmacy. So I think instead of, I would think that you will be given a choice. You would know whether you want to be registered for which vaccine or not. The issue is all these vaccines, it protects you from contracting COVID or developing severe symptoms of COVID. If you protect yourself early, you are protected. And the message is, despite slightly difference in the efficacy of all these vaccines are all shown to reduce the severity and hospitalization related to COVID. Whatever vaccine you can get your hands on, get it.
Thank you. I also wanted to ask about patients in hospital who are elderly. Are they able to get the vaccine through any current means? And is the health unit having discussions about this?
So we are talking with our hospital partners and finalizing some protocols to vaccinate the 80 plus people, just as part of the broader community strategy. So anyone 80 plus should be able to get their vaccine in the hospital very shortly. I think that again, it goes back to the logistics of how do we track who will need the second dose, how they will get the second dose. So some of these logistics are, even though it may sound trivial, but it's not. And hopefully we should be able to start doing that soon.
Thank you.
Any further questions from Blackbird?
No, thank you.
Windsor Star?
Nothing further, thank you.
AM 800?
Dr. Ahmed, I'm not sure if you know, but during the newser just now, Health Canada has approved Johnson & Johnson vaccine, just with another vaccine being approved. Just want to get your thoughts.
Surprised. That's my thought right now, but happy because I think it's a good vaccine, and again, it gives us more tools in our arsenal to combat COVID. And I'm sure that this vaccine will be very much appreciated by our primary care providers, especially because it's a fridge-stable vaccine, and I know our primary care providers are ready to vaccinate people. And given that they can keep it in their freeze in their normal vaccine fridge and able to vaccinate people, I think this would be a really important milestone in our fight with COVID. And I have to see the details. As I said, that I just heard from you, and Mike confirmed. So we'll have to look at the details, but really excited and hoping that we get hands on those vaccines and roll it out as quickly as possible.
So from what you heard about this vaccine, it seems like it's a very positive one in the sense where it can be stored in different offices.
Yeah, I think if I remember correctly, the efficacy was between 80 to 85% with this vaccine, and it's a single vaccine so far, single dose vaccine. So that's another benefit of not having to worry about how do we track people for their second dose. And because it would be a fridge stable vaccine, we won't have to worry about how do we mobilize these vaccines, how do we drop off these vaccines to the clinics, and then how they will store the vaccine and not waste it. So overall, I think it's all good news, and looking forward for additional details on that.
That's it for me. Have a great weekend. Thank you.
Thank you.
Thank you, everyone.
Thank you.